Hi, this is Brian Kim. I'm going to share with you case number 284 in the best way to do cataract surgery series. And the title of this series is not to suggest this is the best and only way, but to get you to think critically of your technique so that you can provide the very best for your patient. So this is a somewhat of a dense cataract. You're going to see me perform my routine technique, double chop and cross chop, and leveraging manual fracturing techniques, crushing the lens pieces into smaller pieces. By doing it this way, I'm able to reduce ultrasonic energy and then achieve clear corneas postoperatively. And I'll be using the Veritas Phaco emulsification system to achieve this. So you can see this patient has a little bit of a Bell's reflex. This is the left eye. I'm using the cotton tip to immobilize the eye as best I can. And this is a corneal marker, which will help me to center and size the rexus. So you can see the overlay, all the fluidics is on the right side as far as the foot pedal, bottle height, aspiration, vacuum, ultrasonic energy. The left side shows my settings of the machine, and it's currently on a peristaltic quadrant mode because, again, my standard technique is just to go straight to chop, and I don't do any sculpting in my standard technique. I make my incision on the right side and then the left side, making sure I'm parallel to iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. And again, I'm using the cotton tip to control the eye the entire time. This is intracameral epinephrine to stabilize the pupil, and this is some dispersive viscoelastic, the endocoat, to coat the cornea and flatten the anterior capsule. And I use that cannula to twist the incision with the Orlock technique to turn the eye down. Again, this is the left eye. And this is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove tunnel, and then I enter. Using that same cannula to control the eye, not just during the incision, but also during capsulorhexis. So again, you don't want to go in and out of the eye too many times. You want to minimize your movements, which again, by minimizing movements, you're maximizing your efficiency and you're maximizing safety as well. So this is a Moria rexus forceps, the microforceps. I puncture the center, pull down towards me, grabbing the right side of the tear, going around circumferentially. Because I have a low profile rexus forceps, I have minimal OVD egress. I'm using the cannula to control the eye as I do the rexus. I have excellent control of the rexus. Again, very easy without any significant concern or risk of a run out. Finish off the rexus. And this is the capsule fornix hydrodissection technique. I place the cannula under the rexus edge contra-incisionally, get a nice wave, lift the lens up, decompress the bag, pushing down on the left side, and then the lens is already spinning. So irrigating the surface of the eye, this is with continuous infusion on and off, and I'm able to toggle on and off with my foot pedal, which gives me excellent control. I turn off infusion, lift the incision, go in with the irrigation off. Lift the incision with the chopper, turn on infusion, remove the surface epinuclear material, and this is the double chop maneuver. I'm going to place the chopper under the rexus edge contra-incisionally, turning the phaco tip vertically sub-incisionally, and then I'm using the instruments to squeeze the lens and crush it manually, and that is the double chop maneuver. Placing the chopper under the right heminucleus while the phaco tip has been stationary the entire time, pulling it centrally toward the phaco tip and fracturing the lens in half, and that is the cross chop. Using high vacuum to grab that first quadrant up. Again, the Veritas has excellent purchasing power to lift the lens pieces up out of the bag. I lift it up with the phaco tip, and then I'm crushing the lens between the instruments with manual fracturing, and then emulsifying the lens piece. Again, very efficient breakdown of the lens in 3 pieces without using any ultrasonic energy or vacuum with the double chop and cross chop maneuver, and then grabbing that first quadrant up very easily using high vacuum and then crushing it with manual forces and then emulsifying it. Performing another cross chop maneuver around that second quadrant, and then lifting that lens piece up with a phaco handpiece, and then crushing the lens manually with instruments and emulsifying the lens pieces. Turning the second heminucleus in front of me, very gently, sliding the chopper under the rexus edge contra-incisionally, pulling it centrally toward the phaco tip, and another cross chop maneuver to break that heminucleus in half, using some vacuum to grab that third quadrant up, getting under it with the chopper, and then manually crushing the lens, making it smaller and smaller, and then emulsifying the lens piece. Grabbing that fragment up with some vacuum again, getting around it with the chopper, crushing it into smaller pieces, and then emulsifying it. Again, excellent control, and I'm able to grab the lens pieces so easily with this machine. Again, the worst thing that can happen is you try to grab a piece and it keeps slipping off your tip, keeps slipping off, and then you get frustrated, and then you might create a problem. Using some vacuum to grab the last quadrant up, getting around it with the chopper, crushing it with manual fracturing forces, crushing the pieces into smaller pieces and emulsifying the lens pieces. And this is the last fragment, grabbing it with some vacuum, holding it on the tip, getting around the lens with the chopper, crushing it into smaller and smaller pieces, and then emulsifying the lens pieces. I'm dramatically reducing CDE in this case. Again, I have excellent corneal protection with this, so my cornea should be nice and clear after this case. There's still some hard fragments that are hiding subincisionally, so I'm grabbing the piece with some vacuum, crushing it between the instruments with manual forces, and then emulsifying it. Very carefully removing some of that epinuchal material. So I take the chopper out, push BSS in, take the Phaco tip out, and I go in with the INE handpiece. I'm adjusting the sleeve. I always start subincisionally, peeling the cortex from anterior to posterior, wiggling side to side to loosen it up, and then manually peeling it, using the INE handpiece to peel away towards the center. And then once it's peeled off a little bit, push the pedal down some more to remove the pieces. So again, the side-to-side wiggle maneuver, and then pushing down on the pedal to peel the rest of the cortex off. So it's a combination of peeling, using the vacuum for purchasing power, but also just pushing down on the pedal to help peel the rest of it off the bag. You just have to be mindful when you're dealing with really high vacuum near the posterior capsule. Foot pedal modulation is very important in these situations. You can see there's a little bit of lens material, some remnants on the posterior capsule, just polishing it using the polish mode. Polishing under the rexus edge. Pulsing BSS into the subincisional capsule fornix, which looks nice and clean. Turning off infusion with the foot pedal, pushing cohesive viscoelastic to fill the bag, and then switching to the Singer Coke sweeper. Polishing under the rexus edge under the left side, and then the right side, removing any lens epithelial cells under the rexus edge. And then switching to the cohesive viscoelastic cannula in my left hand, using it for leverage so I can push the injector into the incision. This injector is a little bit larger than the other one I used on the other machine, and so you have to use a little leverage to push it in. And the DC-BU lens goes in really nicely within the bag. But I like to use that cannula, the viscoelastic cannula, to disengage the haptics off the optic, making sure both haptics are within the bag. Again, this lens is a little bit stiffer. The lens material itself is super clear and has great longevity. It's really the envy of lens materials in the hydrophobic acrylic realm. Getting underneath the lens, removing the viscoelastic from within the bag, repositing the optic back down, polishing under the rexus edge, removing the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a dense cataract, and I perform double chop, cross chop. Using manual fracturing techniques, I'm able to break down this lens very efficiently using only my instruments without using ultrasonic energy or vacuum. And then once the lens is broken down, I'm able to grab the piece so efficiently and easily with this Veritas Phaco emulsification handpiece. The holding power is really superior to anything else I've used. I'm able to just get real close to the piece and grab it and pull it up. The worst thing that happens with any machine is you try to grab pieces and they just keep slipping off the tip. And that's when people start to make mistakes, get frustrated, push down more, go down more, and then you can rip something. You can rip the posterior capsule. I have no issues with that. Normally my technique is to pull pieces up out of the bag with the chopper. Well, I didn't have to do that at all in this situation. I'm able to rely on the machine to grab the pieces up out of the bag. It has great suctioning and holding power of the lens pieces. And then I get around the piece with the chopper when I'm holding it with the Phaco tip, get around it, flank it, and crush it with manual forces. And then fluttering my foot pedal, I'm able to emulsify the lens pieces very efficiently. Again, minimizing ultrasonic energy in this situation with excellent efficiency, no post-occlusion surge issues. This chamber is super deep. And this machine gives you a lot of confidence and ability to efficiently fracture the lens, especially when you're using techniques like mine. So I hope this was helpful to you, and I thank you for your attention.